Are your aching joints holding you back from living the vibrant, active life you deserve? What if I told you that the secret to unlocking relief lies in understanding the powerful connection between your genes, your environment, and your body's immune system? Stick with me because in this video, we're diving into how you can take control of joint health, no matter your age, and start feeling stronger, more energized, and pain-free. And if you're new here, I'm Dr. Gayla Gorman, a licensed acupuncturist, naturopath, and author of What's Your Kryptonite? On this channel, I'm here to help you reverse the effects of chronic stress so that you can cruise through midlife and beyond symptom-free, so that you can put an end to common midlife symptoms like chronic fatigue, insomnia, mood swings, issues with gut health, and even weight gain. Let's start with what inflammation actually is and how it creates joint pain. So it's a biological response, essentially, of the immune system. And so when your immune system picks up that you're being harmed in some way, think like a pathogen of some sort. Typically, that would be a bacteria or a virus. But in this case, it might be damaged cells or even some form of toxicity that your body is trying to manage. So in the context of your joints, inflammation plays a crucial role to kind of protect and make sure that these harmful substances don't create long-term damage. And when inflammation occurs in the joints, it typically involves increasing the blood flow, and this causes redness and maybe even warmth in the affected areas. There's also typically some fluid accumulation, and there may even be some swelling or even a feeling of pressure within the joint, maybe like restriction of movement due to the pressure within the joint. And there's also a release of these inflammatory chemicals. And so these inflammatory chemicals can irritate the nerves, and that also can be a cause of pain. The other thing that happens is white blood cells rush to the area, and that actually is attempting to kickstart the healing process, but all that extra emphasis in that one area basically makes the joint painful, restricts the movement, and that's what we know as pain and inflammation. So there's a number of ways, or if you want to call it mechanisms, that inflammation actually creates joint pain. First is synovitis, and this is essentially in the joint lining. And so there's chemicals that get released that irritate the nerves and increase the fluid in the joint, like we've been talking about here. And this basically leads to pain and swelling. There also may be cartilage and bone damage. So when inflammation continues over a long period of time, there might be erosion of the cartilage or bone, and this can result in significant pain and even reduced joint function. My husband went through a hip replacement. Actually, it was a hip resurfacing operation recently because he had essentially suppressed symptoms related to his joint inflammation for so long that there had been cartilage and bone deterioration to the point that it was irreversible, and surgical intervention was the only thing that would fix it at this point. And so that's a cautionary tale, because I don't want you to get to the point where surgery is your only option. I want you to reverse this damage early enough so that your body can do the repair work it's designed to do naturally. There are some things that really have just kind of gone too far, and surgery really is the only viable option, but there are a lot of points along the way that you suppress symptoms or ignore the problem, And those were points where you could have made different choices that would have given your body the rest and break it needed to free up some resources to be able to do this repair work. Sometimes a swollen joint capsule will actually build up fluid, and this again creates this pressure and stiffness and pain. Probably the most problematic, though, is the nerve activation. And when these inflammatory chemicals aggravate the nerves, that's when you really end up being in a lot of pain and really just feel like you are at the point where you've got to do something. Typically, people will turn to anti-inflammatory medications, over-the-counter medications. And, if you do that once a month, honestly, I wouldn't even recommend once a month. I probably don't have a problem with it. But if you're using these anti-inflammatory medications more than once a month on a regular basis for any purpose, you need to be taking a different approach. And in a few minutes, we're going to talk about some of the things that you can do. But just know that the anti-inflammatory medications really have additional interactions, essentially side effects in your body, and even though they are numbing the pain, they're creating a lot of internal damage and actually allowing you to continue damaging these joints, where you will end up with your only choice being surgical intervention. So muscle weakness happens because the inflammation essentially puts stress on the joints, and eventually our body has sort of a protection mechanism that kicks in, and the nerves are silenced to some degree, and that weakens the muscles. The muscles are weakened essentially on purpose to keep us from further damaging whatever it is joint that's being affected here. And so if your muscle's feeling weak, use that as a sign that you need to take this seriously. That's a sign that things have advanced to the point where your body is in heightened alert mode. And it's basically raising the red flag and saying, we have got to do something different here to reverse course. So pain essentially is referred to as arthritis. And so let's talk about the different types of arthritis and how they're different. So we're going to talk about the three main types of arthritis, and that starts with osteoarthritis. And so in the case of my husband and his hip, he had osteoarthritis that had essentially deteriorated his hip joint, and it was caused by wear and tear of the joint cartilage over time. As the cartilage then broke down, it was bone on bone, and then it begins to even wear down the bone, and that's when it gets really serious. This affects the whole joint, including the bone, the cartilage, the ligaments, and the muscles. It usually affects one or more large weight-bearing joints, like hips or knees are the most common joints that essentially end up getting replaced or need surgical intervention, because these are the joints that we tend to overuse and ignore when they start barking at us, telling us that they need some help. Pain typically gets worse with activity, and you'll feel better with rest. So this often develops gradually. It's more common with age because really the wear and tear on the joint increases as we age. But I talk a lot about how we're living longer, and it's going to be commonplace to expect to live to 100 plus. So taking good care of your joints so that your mobility is preserved is going to be key to living a full and fulfilling life well into your advanced years. So this is a really important video and information for you if you're finding that you've got pain and inflammation, particularly in your joints. something to take serious right now and start doing some things to reverse that damage. Rheumatoid arthritis, on the other hand, is an autoimmune disease, and this essentially is where the immune system attacks the joints. It causes inflammation in a similar sort of way. It's in the synovial membrane that protects the joint. It also tends to affect multiple joints, but most commonly in the hands. That's where you most commonly see rheumatoid arthritis. And that's when basically the hands will be disformed or the joints, like the knuckles, will be enlarged. Symptoms include joint pain, stiffness, swelling, and can be warm to the touch. Keep in mind that this is an autoimmune condition. And so if your immune system is flared up and that is flaring up rheumatoid arthritis, then it makes sense that you would have flu-like symptoms, fever, fatigue, loss of appetite. So again, don't ignore those signs and symptoms. If your immune system is on heightened alert, some form of toxicity has created a situation where your body needs to go into defensive position. It's essentially running from a lion. And so we need to soothe everything, calm everything down. Most importantly, figure out what it is that is actually causing the flare up. And if your immune system is firing and creating rheumatoid arthritis, just know that it's also affecting other things systemically, internally, and creating other problems that are probably going unaddressed as well. So rheumatoid arthritis can affect people of any age, including children. So this is really one of those situations where we really start talking about toxicity and how toxicity is creating stress in the body, and stress creates 90+% of disease. That's what the research has shown. And so stress leads to dis-ease, and dis-ease escalates to disease. The next type of arthritis I want to talk about is psoriatic arthritis. And this is inflammatory arthritis associated with psoriasis, a skin condition. It can also cause joint pain, stiffness, and swelling, and really can affect any joint in the body. It can cause changes in your nails or even skin lesions. And again, this type of arthritis is going to be related to some sort of autoimmune flare-up. And so there's lots of things you can do to quiet those reactions in your body, starting with understanding the effects of stress and how stress relates to any of these autoimmune conditions that are creating problems, including pain and inflammation, as we're talking about here. The main differences between these types of arthritis are really their cause. So osteoarthritis is due to like mechanical wear and tear. Rheumatoid arthritis and psoriatic arthritis are autoimmune conditions. And so that's the difference. Is it an autoimmune condition or is it really just wear and tear? And I would say probably that there is a genetic component. We're going to talk about that in a few minutes with either way that this joint pain occurs. So we'll get there in a few minutes, but osteoarthritis typically affects just single joints, and RA or psoriatic arthritis really involves multiple joints. It's more systemic, definitely. There's also spondylitis, which primarily affects the spine. I didn't go into that in detail here. That's a much more severe condition and probably warrants its own video, but it is a form of arthritis that affects many people. Osteoarthritis is more common in older adults, and RA and psoriatic arthritis can affect people of any age. We already sort of covered that. So it's just important to know that arthritis can show up in a number of different ways, and you really need to understand whether it is the result of an immune system flare-up or the result of, overwork, overuse, essentially. So let's talk about genetics and how genetics factors into this autoimmune reaction, but also joint deterioration and even just overall inflammation and pain. And so really you have to evaluate your environment versus your genetics. And so the relationship between genetics, joint deterioration, autoimmune conditions, and environmental factors related to arthritis is really complex. So here's just an overview of how these elements interact. So genetic factors contribute to the risk of developing autoimmune arthritis, particularly rheumatoid arthritis. The strongest genetic association for RA is with variations in some of the genes that have been found to be particularly correlated, highly correlated. There's 150 genetic locations that have been associated with RA. So it is something that you can inherit, but I just want to point out that genetic factors only account for about 40 to 50% of the RA risk. And so when people come to me and tell me that they have a certain condition because it's genetic, I point out that there's always a percentage of a risk factor. And so in this particular case, let's just say it's 40 to 50%. And so 50% of the people with the same genetic markers didn't get RA. And so what was it about their life and lifestyle that made their body more immune to the risks of the genetic risks of developing arthritis in this particular case? Honestly, though, any disease that is linked to genetics, I would use the same thought process. If there's unless you're going to tell me that 90% of anyone with this genetic marker is going to get this disease, and so that 10% is just, a factor that we almost have no control over, I'm going to tell you that I want you to be in the percentage that doesn't get it. And the way we're going to do that is by managing the toxic stressors. And one of the ways I do that, I recommend that you do that, is to initiate a human energy system reboot. If you're wondering about that, you can find a link to it. If you go to drgala.com/links, there's a link to it there. You can learn more about it. So if you have a family history of RA, it does increase the risk. So I will give you that. It's, in this particular case, they're saying 40 to 50%, but just know that it's these environmental factors that interact with the genetics. And so the environmental factors are what actually switch on the genetic predisposition. So this is often described as the Bermuda Triangle of genetic and environmental factors when among the scientific community that is doing this type of research. While genetics play a significant role, environmental factors are estimated to account for up to 70% of autoimmune disease risk. Now, for me, that makes total sense. So I want to do everything I can in my environment. This is typically lifestyle choices, but a lot of these tricky toxins, I call them, are invisible. We can't see them. We don't know they're there. We don't understand how they're triggering our immune system. I evaluate 12 categories of toxicity, and most of them are unrecognizable, and medical doctors may not even evaluate them or take them seriously. And that's how we end up with so many of these mysterious conditions that we just can't reverse. And so the interaction between genetic and environmental factors is really crucial to determining how we're going to reverse course. We've got to figure out what's causing the problem. I can work with somebody and help them kind of reduce the toxicity and really reduce it to a level where symptoms recede, But it's going to come back if we don't eliminate the factors that were contributing to it in the first place. And so that's why I want to get to the root cause. I want to know what the source of that toxicity is. What's your kryptonite? There's a reason why I named my book that. So unlike genetic factors, many environmental risk factors are modifiable, meaning, you can make changes to lifestyle and that sort of thing, changes to how much stress you take on, that sort of thing that will really create opportunities for prevention, certainly, but also intervention if you're also finding that you're experiencing symptoms already. These kinds of things are fairly easy to reverse if you take the appropriate steps. So this is just an example of one of the countless ways any of the categories of toxic stressors, in this case genetics, create symptoms and other health issues, especially during midlife. I created a video that shows you how to eliminate symptoms that often accompany midlife naturally. So I'll make sure to link to it below this video, but make sure you hit subscribe too, because I share lots of tips when it comes to dealing with stress that's become toxic. Relieving the nasty symptoms stress creates makes navigating through menopause a breeze. So let's talk now about some of these lifestyle changes that we can make that will really make a difference. The human energy system reboot that I recommend is a 7-way approach. And so I use some of these methods, but what I do is combine them to amplify their results. And so a human energy system reboot is what I would recommend, but these are some of the components that go into that human energy system reboot. So anti-inflammatory diet is what's typically recommended. It's really mostly focused on eating high quality, nutrient dense foods that tend to not create an inflammatory response in the body. People often adopt an anti-inflammatory diet if they've got heart disease or arthritis or other inflammatory conditions. So the diet emphasizes the consumption of specific foods that really are known to not be inflammatory, but even may be anti-inflammatory. So the key components of an anti-inflammatory diet include fruits and vegetables, particularly berries. They're really high in antioxidants and vitamins. Leafy greens, think spinach and kale. These are high in vitamins and minerals help to combat inflammation. Then there's the cruciferous vegetables, broccoli, cauliflower, Brussels sprouts. These contain sulforaphane, which reduces inflammation. The other really important thing to take care of is your fats consumption. And so if you are eating at restaurants, just know that you are consuming a lot of what we think of as bad fats. Restaurants typically do not use the high quality oils. If you're cooking at home, which is going to really be necessary most likely if you have this sort of condition, if you're using high heat, you want to use something like avocado oil. But if you're not using high heat, you can use olive oil. You want to use extra virgin, high quality olive oil. This is really considered to be the primary source of healthy fat. And this is why it's often called the Mediterranean diet, because that is essentially where most of the really high quality olive oil comes from. It includes this anti-inflammatory compound. The other things that can be really helpful, you're going to want to be consuming enough protein, but particularly fatty fish. So salmon is really helpful. Mackerel, honestly, I would never consume a mackerel, but if you can handle any sort of fatty fish, this is going to be really helpful. These are high in omega-3 fatty acids, and these help to reduce inflammatory markers. Honestly, I prefer getting my essential fatty acids from cod liver oil capsules. It's just much easier for me to swallow it and let it digest into my system. And that way I know I'm getting the nutrients that my body needs. Normally, I do not recommend taking any supplements long term, but essential fatty acids are considered more of a food enhancement. And so the cod liver oil, if this is a condition that you struggle with, you may need to take cod liver oil regularly and keep your body in a state of reduced inflammation. Grains are often recommended, but I would caution you with grains or even nuts and seeds. Many people find that they actually have an immune response to these types of foods. And so while they might be healthy, they can cause an immune response. And so something like almonds, for example, while I don't have an allergy to almonds, I have a food sensitivity with almonds. And so if I were to eat almonds or even baked goods made with almond flour, they really irritate my digestive system. And if you're someone who's dealing with inflammation and these arthritic conditions, then anything that is causing your immune system to spike simply must be eliminated from your diet. Some of the herbs and spices you can turn to include turmeric. This contains curcumin and it's known for its strong anti-inflammatory effects. Again, this is one of those spices that unless you cook Indian food, you're probably going to want to take it in capsule form because you would never want to put that much turmeric on your food, most likely. Ginger is also really helpful. And so anything you can put ginger on that enhances its flavor for you is going to do a lot. Ginger is great for immune system boosting. And so you really want to turn to ginger whenever you can. So you really want to lean into ginger. Ginger is your friend if you have these inflammatory conditions. So when we start talking about this immune system reaction to foods, this is where we really look at food sensitivities or even potentially food allergies. What I tend to find though is that if somebody has a food allergy, they're already avoiding it. It's not really a problem. When they've got a food sensitivity, their system is just always fired up, but they don't even really realize it because their immune system is managing it fairly well if you don't connect the dots between all the symptoms you're experiencing and this constant state of inflammation and heightened immune response. This is why I typically recommend for people to avoid what I refer to as the Fierce Five. And the Fierce Five is gluten, dairy, yeast, sugar, and alcohol. And so if you will avoid those five things, some people also need to avoid any grains and nuts, but you can start with the Fierce Five. That's just one of the 7 ways we initiate a human energy system reboot. And I suggest you start with a week and see how you do. And if you find that it really helps, then you can continue it or really like pick and choose or at least try to moderate. We also want to make sure that we're avoiding processed foods. These are going to be high in sugar, and especially the unhealthy fats. Also, refined carbohydrates like white bread and pastries. If you're trying to avoid the Fierce Five, a lot of times they're going to include most of the Fierce Five. So they're not going to work for you. Also, sugary beverages, even sugary beverages that used fake sugars. These are going to do more damage than you realize, even if you're using something that is supposedly 0 calories. It's still spiking your cortisol, and your system is sort of like still recognizing it as a sugary substance due to the taste. And so even though you're not getting the calories, it's still causing damage. And the kind of carbonation they use in sodas is particularly challenging for your body to manage. If you really like the carbonation, I recommend drinking mineral water. That's a really good source for minerals that tend to be sorely lacking, and it can be a really nice thing that can replace even alcoholic beverages if you're trying to reduce your consumption of those. And speaking of alcohol, alcohol can really promote inflammation, especially when it's consumed in large amounts. So, in summary, anti-inflammatory diets really focus on consuming nutrient-dense foods while avoiding the foods that trigger inflammation. So, nobody can go wrong with eating whole foods that are nutrient-dense. That's just going to promote overall health and well-being, and regardless of your current health condition, you will benefit by consuming more whole foods that are nutrient dense. There are some natural remedies for inflammation, including inflammation that is creating joint pain and arthritis. So the top 3 herbs that are commonly used for joint inflammation are boswellia, and this is known as Indian frankincense. It contains these acids that have potent anti-inflammatory properties. It helps to inhibit some of the enzymes that are involved in the inflammatory molecules. So boswellia can reduce symptoms of osteoarthritis and even rheumatoid arthritis by decreasing inflammation and improving joint function. Next would be turmeric. We talked a little bit about turmeric earlier because, turmeric is a commonly used spice in food. And turmeric is renowned for its anti-inflammatory effects, primarily due to the curcumin. That's its main component. And the curcumin blocks the inflammatory cytokines and enzymes. So I would just be cautious with this because if you've got an inflammatory response going on, you want to get to the bottom of what's really causing the inflammatory response, not just try to quiet the inflammatory response. And so if you know what's going on and you're working on quieting it, then anything you can do to relieve some discomfort while you're taking the appropriate course is totally acceptable. But if you are trying to medicate these things, even with natural substances, to kick the can down the road so that you don't have to figure out what the root cause is, then you're going about it all wrong. You need to be taking this seriously because you do not want to go through surgery. Joint surgery is major surgery. And if you can avoid having your body cut into, you definitely want to take that as your path of least resistance. So back to the curcumin though, it has been shown to alleviate pain and stiffness associated with arthritis. So it is popular for managing joint inflammation. You can combine turmeric with black pepper, and this apparently even enhances the absorption, which makes it more effective. And then again, let's talk about ginger. The compound in ginger is gingerol and shogal. And ginger possesses anti-inflammatory properties that may help reduce joint pain and stiffness, particularly with osteoarthritis. So not quite as good maybe with rheumatoid arthritis, although I will say that ginger can be really helpful with the immune system. Research does suggest that ginger can block inflammation pathways in the body, contributing to its effectiveness to alleviate symptoms related to joint inflammation. So these herbs can be consumed in various forms. Capsules can be really helpful, making it really easy to get them regularly and in enough quantity. They can also be consumed typically as teas and obviously as a culinary ingredient. It makes sense to include them fresh when you're cooking, when at all possible, but you're not going to use them regularly enough to really make a difference for you if you're only using them with your meals. And remember that if you have any diagnosed medical condition, you want to consult with your healthcare professional, especially if you're on any medications, before starting any new herbal regimen, because there can be interactions between medications and herbs. So we talked about omega-3 fatty acids, and fish oil is rich in these omega-3 fatty acids, particularly EPA and DHA, and these have been shown to reduce inflammation and improve joint pain. Studies indicate that omega-3s can help alleviate symptoms of rheumatoid arthritis and osteoarthritis by decreasing the production of inflammatory substances. So I recommended that you take high quality cod liver oil supplements. Again, it's just easier sometimes to take a supplement, especially if you need things that I would consider nutrient enhancement or diet enhancement. And if you can't get enough of it in your diet, then you may need to essentially enhance your diet with these supplements. Vitamins and mineral deficiencies can also significantly impact joint health and can really exacerbate inflammation and pain. The most common deficiencies associated with joint issues include vitamin D. And so vitamin D is crucial for calcium absorption and bone health. And a deficiency in vitamin D has been linked to increased joint pain and inflammatory conditions like rheumatoid arthritis and osteoarthritis. And so it plays a role in modulating the immune system, which is essential for managing the inflammation in the joints. The other thing that may be deficient is vitamin B, and particularly vitamin B complex, meaning it goes beyond just a single B vitamin. Deficiencies in B vitamins, particularly B6, B9, which is folate, and B12, can contribute to musculoskeletal pain and inflammation. These vitamins are vital for energy metabolism and the maintenance of healthy nerve function, which can influence pain perception and inflammatory responses. And then there's selenium. Selenium is an antioxidant that helps combat oxidative stress, and oxidative stress can contribute to inflammation. So low levels of selenium have been associated with increased joint pain and conditions like arthritis. It's been linked to issues with digestion and overall gut health as well. So ensuring adequate selenium intake may help mitigate some inflammatory processes in the body as well. So addressing these deficiencies through diet or supplementation can be beneficial for anyone experiencing joint inflammation. And just lastly, one more reminder, if you have a diagnosed medical condition, you want to check with your healthcare professional, with your medical doctor, to make sure that anything you're looking to introduce is not going to interfere with any medication or conflict with any of the treatment they're recommending. Magnesium deficiency can contribute to inflammation in a number of ways. It can really lead to increased calcium levels because magnesium acts as a natural calcium channel blocker. And so when magnesium levels are low, calcium gets into the cells easier and in higher quantity, and this basically primes the cells to initiate an inflammatory response. So you've probably heard that it's really important to balance your mineral intake, especially calcium and magnesium, and this is one of the reasons why this is so important. That heightened calcium signaling can lead to the activation of immune cells like macrophage and leukocytes, and these release pro-inflammatory cytokines, even tumor necrosis factors. So you really want to make sure that you're not deficient in magnesium and that your mineral balance is taken into consideration. Low magnesium levels can lead to oxidative stress as well, characterized by imbalance between free radicals and antioxidants in the body. This oxidative stress can damage cells and tissues and really just make any inflammatory process worse. And so magnesium helps control oxidative stress by acting as a cofactor for various other antioxidant enzymes. So it's really important, again, to make sure that these things are balanced. What cofactor means is that it works in conjunction with something else, and so the balance has to be there. One thing can't do its job without the help of another. In summary, magnesium deficiency creates an inflammatory environment by increasing calcium levels and activating inflammatory pathways, and this contributes to oxidative stress. And oxidative stress, honestly, creates a lot more damage than joint pain and inflammation. So this is something that you definitely want to reverse at the first signs. So you want to make sure you're ensuring that you're getting adequate magnesium and to mitigate any of this inflammatory response. That's really making it difficult for you to achieve optimal health and well-being. And if your best efforts to live a healthy lifestyle and do all the things you've been led to think are supposed to work aren't getting the job done, you may even be feeling like you take 2 steps forward and 3 back. In my next video, I'll show you how to manage the toxic stress that's sabotaging your efforts. You can eliminate the symptoms that seem to be piling up in midlife naturally without medication, crazy diets, intense exercise, or any other unsustainable lifestyle hack.